Good morning. My name is Jonathan Batson, and today I'm going to speak about Howard University Summer Medical and Dental Education Program. I was compelled to create this video because I want to give students an insight of my experience in 2009 of the program and what I thought of the program, and hopefully it would influence you next year for those who are interested in SMDEP to not overlook Howard University and the great work that they're doing through the program. Um, so for those that may not know, SMDP is a Robert Wood Johnson Foundation initiative to help eliminate health disparities through the increasingness of trying to um, get minority and students that are underrepresented in medicine a chance to get academic enrichment to pursue their dreams of becoming a physician. And from my experience at SMDEP, I can't say that I was more prepared to be one step closer to my dreams of becoming a physician. So Howard University is based in Washington D.C. and for those that may not know, Howard is a historically black college. Um, it was founded at a time when um, people of color were not able to go to certain schools, and you know, in essence, it's one of the, I guess, elite schools for underrepresented minorities. Um, their mission is very tied to the social mission aspect of medicine, and they are a research institution as well. So if you're interested in probably doing a PhD there, I think it's a great resource. And the NIH is close in Maryland, and also you're able to get experience at policy work and things of this nature. So I think DC is the epicenter for a lot of things that you could do within the medical um, system. So going back to the goal I had, um, Howard University SMDP was a great experience for me. It was 8 weeks on the Howard dorms, where we took classes that were taught by medical instructors as well as instructors from the undergraduate, the College of Arts and Science. So I took courses in physics, um, biochemistry, and cellular molecular biology, epidemiology, um, biostatistics, and cultural competency. And we also got forums to help us with personal achievement and enrichment. So interviewing skills, personal statement workshops, financing and medical education. I think the program was wonderful. When I first went into the program, I wasn't sure that I was gonna get a great experience, but my mother always told me that regardless of what we may believe, we always need to have an open ear and an open heart. And with that, I decided to give it a chance. The first week, it was superb. 80 students, 20 guys and 60 girls from all over the country, from various ethnic backgrounds and social backgrounds as well. Um, so I was able to interact with a lot of students that who had a mission for helping the underserved, and that's something that's highly um, brought out to the program, about underserved populations and health disparities. Um, for those who may not know, health disparities is basically um, issues that affect the medical system in terms of deliverance of healthcare due to barriers such as um, social unawareness, cultural incompetency, the lack of physicians that are minority, or language barriers and things of that nature. Um, so the first 2 weeks of the program was more so on the academic portion, and we had mentors that were medical students that would help us gear us through our courses, helping us with tutoring, and also just being a listening ear. Um, the last 4 weeks actually, we had shadowing through Howard University Hospital, which was also in the past known as Freedman's Hospital. Um, Great thing about Howard University is that if you're interested in um, going to a diverse population of plethora, a plethora of health issues and people that the uninsured and things like that. Howard has that social mission to help people that don't have the opportunities to get the health resources that they need. So that's something that I liked about Howard. Um, so I shadowed. There were different shadowing opportunities, but I shadowed internal medicine and neurology, which are um, I wasn't open to it at first because I always thought I would be a surgeon, but actually after being part of the program, I understand that a lot of people in this country, don't have the resources that they need, and primary care is actually something that we're underserved with. Actually, it's interesting. They said in 2025, this is statistics that is done. You can look it up. In 2025, there will be a lack of primary care physicians in the United States. That is a alarming issue. The United States is becoming ever evolving and is becoming more diverse. People from various cultures and different backgrounds. And right now, minorities are mostly underserved and not able to have. They're less likely to have insurance or to get medical treatment that they need. And due to that alarming statistics, in 2025, 2050, the minority populace will be the majority. So if we are, less likely to get the health access that we need and more likely to be sick and majority of STIs and comorbid diseases, happen in our population, then what would that mean for medicine in general? So we need to address these focuses now, and Howard University gave me that structure to understand that health disparities are something that we need to focus on in the medical education system to build more competent physicians to address the needs that we need for the future. Um, so, and academically, I thought it was superb. Um, we got an introductory course into physics, like I said, and all the other biological sciences. And but their more main focus was on personal enrichment and motivation. So, being at Howard campus, I was able to see the first time, which may sound crazy, but the first time I've seen an image of myself, somebody like myself, educated, um, and have the passion to serve regardless of people's circumstances, and it's something like that that I personally fell in love with, and everybody's not gonna take every program the right way due to what they want to experience. But I think that everybody should try to at least look into Howard University due to their social mission efforts. And I think the program is a great experience, but you have to be, the determining factor. Something is given. They always say that you can bring a horse to the well, but you can't force it to drink. That's true. So I used the opportunities that were given to me through Howard, and due to that experience, it's cultivated my ambition to be more of a culturally aware, socially aware, and a physician who would want to help the underserved. And due to that, the installment of their program, I created a program at my school to focus on the issues of the underserved population. And through that, I actually got into this program this summer at the University of Miami. But Howard University program was superb. A lot of people that were into the program, I still are in contact today, and I also a lot of the people got into medical school. Um, but going into that, the program isn't really, although they're trying to instill certain values to help you push your career. The platform to get into medical school will always be different. And you have to know what you have to do to get into medical school, whether it's your community service, your grades, and this and that. So even though the program's aptitude is to really get people into medicine, it doesn't matter the track or how long you get there, because the race is not for the swift or for the strong, but for those who can endure till the end. So if you have any other questions about SMDEP specifics, I know I didn't go into specifics. scientifics, but if you want to know more about it, please feel free to comment below, and I'll definitely respond. So thank you, and have a blessed day.